The United States spends more on healthcare than any other country in the world, yet its outcomes often fall short compared to nations that spend far less. Given the soaring expenditures that keep going up year after year, it's critical to comprehend the factors that contribute to the exorbitant costs of the American healthcare system. The US healthcare system functions significantly differently than those of other industrialized countries, from the intricacy of insurance plans to the predominance of private, for-profit businesses. Even with the staggering amounts of money spent on healthcare, access is still uneven, and the emphasis is frequently on curing, rather than preventing disease. There is increasing discussion on the sustainability of the current system as a result of this paradox: high investment combined with subpar results. The 7 main causes of America's status as the most costly healthcare system in the world will be dissected in this essay. 1. The costs of administration. An intricate bureaucracy. The enormous administrative strain on patients, insurers, and healthcare providers is one of the main causes of the high cost of healthcare in the United States. With numerous private insurance plans, government programs like Medicare and Medicaid, and healthcare professionals participating in providing care, the US healthcare system is infamously complicated. Administrative procedures such as billing, coding, processing claims, and regulatory compliance are necessary for each of these organizations. Studies show that in the United States, administrative expenses make up over 25% of healthcare expenditures. On the other hand, nations with single-payer systems, like the United Kingdom or Canada, have far lower administrative costs. In the United States, expenditures are greatly increased by the sheer amount of paperwork, numerous insurance companies, and disjointed systems. To handle the complicated insurance environment, hospitals, doctors, and insurers need to keep sizable administrative teams and systems in place, which further complicates the process of providing healthcare. Patients bear the consequences of these costs in the form of increased out-of-pocket payments, deductibles, and premiums. These overhead expenses may be greatly decreased with a more straightforward and efficient approach to healthcare management, but reform is still elusive because of the vested interests of the several stakeholders. 2. Exorbitant costs for medications and medical services. The cost of prescription medications and medical services is among the highest in the world in the United States. The United States lacks a unified or centralized system to control healthcare costs, in contrast to other nations. Therefore, market factors, such as discussions between providers, insurers, and pharmaceutical companies, frequently decide the costs of medical operations, hospital stays, doctor visits, and prescription drugs. For instance, compared to other industrialized nations, the cost of a typical medical procedure, such as an MRI or an ER visit, can be several times more in the United States. Lack of competition or market consolidation frequently allows hospitals to charge higher rates, especially in rural areas where there may only be 1 or 2 hospitals. Insurance firms frequently pass on the expenses to their policyholders in the form of higher premiums and co-pays rather than negotiating better prices for consumers. The cost of drugs is likewise soaring in the United States. The United States permits drug manufacturers to establish their own prices, which frequently leads to excessively high costs for pharmaceuticals, in contrast to other nations that negotiate drug prices with pharmaceutical corporations or impose price ceilings. For instance, insulin and other life-saving medications can cost several $100s a month in the United States, but they are substantially less expensive in other nations with price limits. 3. The model of fee-for-service. The fee-for-service FFS model, which is largely responsible for the US healthcare system, pays healthcare professionals according to the quantity of services they give rather than the caliber of treatment they provide. This approach prioritizes quantity over quality, which results in pointless examinations, operations, and therapies that raise expenses without always enhancing patient outcomes. Because hospitals and physicians are compensated for each test, scan, consultation, and procedure carried out under the FFS model, there is an incentive to undertake more work, even if it is not really necessary. Overuse of healthcare resources, such as numerous readmissions to the hospital, needless procedures, and excessive prescription drug use, is facilitated by this system. Value-based care approaches are emphasized in other nations, such as the United Kingdom with its National Health Service, NHS, where medical professionals are compensated for enhancing patient outcomes and offering economical treatment. The US FFS approach, on the other hand, promotes overtreatment, which drives up overall medical expenses. 4. An emphasis on therapy rather than prevention. The primary purpose of the American healthcare system is to treat, not to prevent, illness and disease, since it is significantly more expensive to treat chronic problems like diabetes, heart disease, and cancer than to prevent them. This reactive approach to healthcare ultimately results in higher expenditures. Changes in lifestyle, early identification, and preventive care can help prevent many of the major causes of mortality and disability in the United States. However, because the American healthcare system places little emphasis on prevention, these chronic illnesses are frequently discovered at later, more costly stages when they necessitate intense treatment. Sweden, Germany, and other nations with universal healthcare systems prioritize preventive treatment, which includes routine screenings, immunizations, and health education. These steps aid in the early detection of illnesses, which lowers the need for costly interventions and the overall cost of healthcare. However, the high costs of treating avoidable illnesses in the United States are a result of both a primary care system that is overworked and restricted access to preventative care. 5. Private insurance's function. The high expense of healthcare in the United States is also a result of private health insurance. With millions of Americans depending on employer-sponsored insurance or buying plans through the marketplace, the United States has a largely private insurance-based system. In addition to often negotiating rates with healthcare providers, private insurers also want to turn a profit, which raises costs. Another problem is the intricacy of the private insurance market. Insurance plans come in hundreds of varieties, each with distinct premiums, co-pays, deductibles, and coverage levels. Customers may find it difficult to understand these plans, which in certain situations may result in underinsurance or overinsurance, because they have to handle claims, confirm coverage, and settle disagreements. This complexity also raises administrative expenses for insurers and healthcare providers. Furthermore, insurers frequently employ strategies like rejecting claims or limiting coverage for specific therapies in an effort to reduce their financial risk. Even with insurance, this frequently results in large out-of-pocket expenses for patients. On the other hand, because there are fewer middlemen and a simpler method of financing healthcare, nations with universal healthcare systems are able to provide more economical, efficient services. 6. The effects of health disparities. The entire expense of the healthcare system in the United States is made worse by health inequities. Treating avoidable illnesses that disproportionately impact ethnic minorities and low-income populations accounts for a sizable amount of healthcare spending. Americans' health is significantly influenced by the social determinants of health, including access to wholesome food, income, and education. And the unequal distribution of resources among various groups raises healthcare costs. For example, chronic diseases like obesity, diabetes, and hypertension are more common in African Americans, Hispanic Americans, and other minority groups. These illnesses frequently necessitate continuous medical attention, raising healthcare expenses for both individuals and society at large. In a similar vein, the lack of primary care access in rural locations drives up healthcare expenditures, increasing the need for costly emergency care. Everyone's medical expenses rise as a result of unequal access to healthcare. Early treatment for problems that others might not have access to until they worsen is provided to those who can afford high-quality care. These inequities are frequently ignored by the American healthcare system, which raises overall healthcare costs and worsens health outcomes for underserved groups. 7. The pharmaceutical industry's impact. The pharmaceutical business has a big say on how much healthcare costs in the US. In addition to the high cost of drugs, the industry's ability to influence policy has been crucial in maintaining high medication costs. The cost of pharmaceuticals is established by pharmaceutical companies. The US government does not negotiate prescription pricing for Medicare, the federal program for seniors. Critics claim that a large portion of the pharmaceutical industry's revenues are allocated to marketing, lobbying, and stock buybacks rather than innovation, despite the industry's claim that high prices are required to finance R&D. Additionally, the United States permits pharmaceutical corporations to maintain long-term patents on their products, which keeps costs high and keeps generic copies off the market. Americans now pay more for prescription drugs than those in other nations due to a combination of high drug pricing, patent protections, and the absence of a price bargaining process. The US system is still mainly uncontrolled, which results in unchecked price hikes, whereas other countries enforce price regulations and engage in direct negotiations with pharmaceutical corporations. In conclusion, due to a variety of intricate elements, including high costs for drugs and medical services, as well as inefficient administration, the US healthcare system is the most costly in the world. The system is expensive due to its reliance on a fee-for-service basis, lack of focus on prevention, and prevalence of private insurance. Additionally, the influence of the pharmaceutical industry and health disparities continue to increase costs while restricting many Americans' access to care. To solve these inefficiencies and lower the cost of healthcare, reform is desperately needed. Other nations have shown that universal healthcare that prioritizes preventive treatment, lowers administrative expenses, and regulates costs is feasible. The United States healthcare system will continue to be an expensive and ineffective anomaly on the international scene unless these fundamental problems are resolved. Let us know in the comments what you think about the why America's healthcare system is the most expensive in the world. And don't forget to like, subscribe, and stay tuned for more captivating content on our YouTube channel.